Hi, guys. Very good evening. I hope you had a nice weekend. It's Monday, 7 o'clock, and today we are going to talk about knee arthroscopy and what are the alternatives or what are the other solutions which you have if you have knee osteoarthritis and you want to have a knee replacement and you want to have some treatment for it done. So we are going to deal with 6 questions today. The first question is, what is a knee arthroscopy? The second question will be, what is knee restoration procedure? If you're somebody who's having early osteoarthritis, definitely this is something you have to watch for. Then what is the difference between this new knee restoration procedure and a knee replacement? Finally, who are the candidates who will really benefit from this knee restoration procedure? And what are the pre-op and the post-op? Basically, how you will have to prepare for it before surgery and after surgery. And in the end, I will be also discussing about bone marrow concentrate. That is the stem cells which are there in your own bone marrow and platelet-rich plasma, because this is what we use differently in a knee restoration procedure. Now, let's start. If you're somebody who's been watching my videos for a long time, then thank you so much. Thank you if you're somebody who's going to watch the reruns of the show also. And if you have any questions, please feel free to jot it down below so that I can answer it in my next live. And if you have any questions right now also, please put it down, because at the end of the live, I will be answering your questions. Now, first, what is knee arthroscopy? Knee arthroscopy is not something new. Knee arthroscopy has been happening for the last 20 years or so. It is just a very simple surgery where if you take the knee, if you see, this is your femur, this is your tibia, and ideally your kneecap will be right here in front. Arthroscopy is nothing but arthro means joint and scopy means putting in a tube or some sort of a hollow structure inside to see what is inside and then to repair what can be accessed. And the beauty with arthroscopy is we do not open, we just use 0.5 centimeter incisions on either side of the knee in order to enter the knee and in order to repair or correct or remove anything from the knee. So this is knee arthroscopy. So what is the advantage of knee arthroscopy? The greatest advantage is it is a day care procedure. You just have to stay in the hospital for a day, and if you have some pain, maximum for 48 hours. And the other advantage is that as it is not an open procedure, wound healing is really not a problem, and your entire body can focus its healing on whatever disease we are repairing arthroscopically. The other thing is return to normalcy is much faster with an arthroscopy rather than with an open surgery. So this is arthroscopy. Knee arthroscopy is when we use cameras and small instruments without opening your knee, but we access and change stuff inside your knee which requires changing. All right. The next question. Now, what is this knee restoration procedure that I keep talking about? So knee restoration is nothing. So till now, if you have osteoarthritis, so we all know that knee osteoarthritis is a very common condition in India. And if you have osteoarthritis, you have a lot of options. You can take painkillers, you can take medication which improves your cartilage growth. You have physiotherapy exercises, other modalities. You can have lubricant injections, you can have platelet-rich plasma injections inside the knee. If all these are not sufficient enough to give you pain relief, then the other option which you had in the past is a knee replacement, where we identify which are the surfaces of the knee which are worn out and we replace those surfaces. And that's quite an old surgery. It has been being performed for the last 50 years now. Now, this knee restoration works on a slightly different concept, where if you are somebody who has osteoarthritis and you have loss of cartilage, again, I'm going to go back to my favorite knee model. So cartilage is generally there on the surfaces of these bones, on the surface of the femur and on the surface of the tibia. Sorry, it's just some pop-up on the surface of the tibia. So if your cartilage is completely worn out, what happens is you start walking in such a way that your entire knee joint starts to have a bend, and that is known as varus. Varus deformity or bow legging in osteoarthritis is quite a severe case of osteoarthritis. If you are somebody who has osteoarthritis and who has pain of osteoarthritis and you're unable to do a lot of activities, but you do not have the varus deformity, then you are an ideal candidate for a knee restoration. Because in a knee restoration, what we do is we identify the surfaces which need to have the cartilage, and we see where the cartilage is thin, and we prepare the surfaces. We prepare the surface of the cartilage, and once the surface is prepared, we harvest your bone marrow cells and your platelet-rich plasma from your blood. We make it into a paste or a thick gel-like consistency, and we place it inside the areas of your knee where your cartilage is worn out. And the science and the rationale behind it is the cells of the bone marrow, which have all kinds of cells, cartilage cells, it has ligament cells, it has bone cells. These cells will go and sit in the areas where you do not have the cartilage cover. And if you don't have the cartilage cover, bone is exposed and you have pain, and these cells form cartilage in those areas. Now, how do we prepare the surface for these cells? We do something known as a chondral fracture, where we create cracks in the cartilage which need to be restored, and in the area of those cracks, we deliver the cells inside. This is what a knee restoration procedure is. And before we do a knee restoration, we do an arthroscopy. The procedure is done with arthroscopy, and we also clean out and trim out all the worn out structures, ligaments, bones, bits of bones which are there from inside your knee. And once the washout is completely done, then we deliver the healing cells inside in different areas of the knee, in the ligaments, in the bones, under the bones, in the surfaces where osteoarthritis starts, and on the cartilage. And these cells help new cells grow, and it restores your knee. Coming to the next part, what is the difference between a knee replacement and a restoration? A knee replacement is generally done for somebody who has that varus deformity, the bend in the knee I was talking about. And when we do a knee replacement, what we do is we do not see where the cartilage is worn out, nothing like that. We remove the surfaces of the knee which are worn out. That is, we remove the surface of the tibia, and we remove this surface of the femur and all the ligaments, soft tissues which are inside, and we replace it with metal and plastic in the middle. So a life of a knee replacement is somewhere between 15 to 25 years, depending upon how many steps you walk, and also depending upon the implant which is used. Now, the advantage of this knee restoration is that, say if you're somebody who's just 50 and you need maybe 5 or 10 years more before you would like to go in for a knee replacement, because the idea should be that we should try to prevent having a revision knee replacement. So the life of a knee replacement, as I told you, is 15 to 25 years. So if you have a knee replacement done when you're 50, then you might need a revision knee replacement when you're 75. So this knee restoration procedure could be a bridge where you could find a few years before undergoing your first or your primary knee replacement. That is the difference between a knee restoration and a knee replacement. Then coming to who will benefit. If you're somebody with early osteoarthritis and your MRI and your X-ray shows that you have space in between both your femur and the tibia, but still it's very significant. Your pain is that much that you're not doing activities which you were doing a few years ago, but on an X-ray and on an MRI, it doesn't seem that you need a knee replacement. So if you're somebody like that and you're unable to play sport, you're unable to exercise, and you want an easy solution, which is not a knee replacement, then this knee restoration procedure could be the procedure for you. And also, if you're somebody who's young and you have severe osteoarthritis, this knee restoration procedure can be combined with something known as a valgus osteotomy of the knee, where even if you're young and even if you have a varus deformity, we can realign the knee and regrow the cartilage using the knee restoration procedure. So anybody young suffering from osteoarthritis, or if you're somebody who's old and you do not want to have a knee replacement for some reason, you feel that you're afraid of it or you don't want it. Guys, trust me, I'm a knee replacement surgeon. It's a lovely surgery if you are ready for the surgery and you want to take the effort which is needed to make that surgery a success. But if you're not ready for a knee replacement, I don't think you should go in for a knee replacement, because you will know if an organ of yours is ready to be replaced. So if you're somebody like that, think of a knee restoration procedure. Finally, what is the pre-op and post-op? Because everybody wants to know how to prepare for this procedure. Basically, it's an arthroscopy. So you'll have to do, it's done under anesthesia. We use either general anesthesia or spinal and epidural anesthesia. The advantage with epidural anesthesia is that you will not have any pain post-procedure also, but it is again a prick in the back. But with general anesthesia, you will not know anything, but you might have pain after the procedure. So I would advise a spinal or an epidural anesthesia. So you will have to do whatever is necessary, the pre-op tests for that. For example, just all your complete blood count, your kidney function test, liver function tests, and serology to see if you have any infections, stuff like that. And then if you're above 60, you need to do an echocardiogram. So once you do all these tests, the team of anesthetists will review you, tell you if you're okay, and then the procedure can be planned. It's a day care procedure. You might have to stay in the hospital for a day or two, depending upon your pain tolerance. Now, coming to the post-op, our patients generally walk the next day. It again depends upon how bad your osteoarthritis is. If you come to us in an early stage or where you do not have too much of a cartilage loss, then your recovery is faster. But if you have a very significant osteoarthritis and we have to do a lot of work on your knee, sometimes the procedure takes 3 hours or 4 hours and a recovery takes longer time. But whatever it is, you need to do your physiotherapy and you need to do your exercises even after the surgery for a period of 3 months and keep your thigh muscles stronger so that the procedure works. All right. So you can go back to office maybe in a couple of days, 2 or 3 days time. But it's not always consistent based on your osteoarthritis or however significant your issue is, your time to go back happens. Then coming to finally, I keep talking about this bone marrow concentrate and platelet-rich plasma. What is it? So now the word stem cells is not used because so many people are just saying stem cells for everything and the world is confused. So bone marrow concentrate is just, we harvest your bone marrow from the pelvic bone, which has the highest concentration of bone marrow. And it is concentrated into a solution which has cells like the tendon cells or the tenocytes, osteocytes, which are the bone cells, chondrocytes, which are the cartilage cells. And we mix it with platelet-rich plasma. Platelet-rich plasma is also harvested from your own blood, and it has a lot of growth factors. So when we mix the cells from the bone marrow with the platelet-rich plasma, then it becomes a really potent healing factor. And this has been used to reduce inflammation and also increase and produce new cells. So with the advent of minimal access, where we are able to reach regions of disease in your body without opening you up, the benefit of these healing cells which are harvested from your own body They just need to be delivered accurately in the region of your problem. And this is what we do in a knee restoration. And this is why these cells have such great benefit. See, everybody is talking about renewable sources of energy to run our lives. This is a renewable source of healing because your bone marrow cells come back within 6 weeks. And the more you take, if you have a healthy bone marrow, more cells are formed, new cells are formed, better cells are formed. Same with your blood. So platelet-rich plasma, stem cells from bone marrow, stem cells from fat. Yes, we can harvest stem cells from your fat, and studies are showing that they play a very important role in regeneration of cartilage. So I believe in renewable sources of healing. And with the advent of minimal access, where we are able to reach areas of your body where you have a problem, we just need these cells to be delivered there so that your cells work to heal your diseases. And this is regenerative orthopedics and regenerative medicine. All right, guys, thank you so much, all of you who watch the show live and all those who are going to watch it as a rerun. And if you have any questions, please post it so that I can answer it in the next session. All right, I'm just going to go to the questions. So I have Arasu, thank you so much for your support. I have Mrs. Rama Satya who says, a big good evening, Doc. Good evening, Mrs. Rama. I'm 49 and playing competitive cricket and a fast bowler. Lately, I am noticing pain in my knees and a sort of fluid around both the thighs. So what you have, if you're a cricketer and you're still playing competitive cricket and you're fast bowling, okay, I hope that you're doing all your stretches. I hope that you're working on your thigh muscles and your calf muscles and your core in the gym, and then continuing to do your fast bowling, because at 49 already you might have some amount of wear and tear in the cartilage, wear and tear in the shock absorbers, which is your meniscus, okay? And if you are not exercising and you're not stretching before, the stress on the already thin cartilage and the meniscus can increase your pain, and that can cause something known as a synovitis. Basically, synovium is the tissue which produces the joint lubricant, and when there is inflammation of the synovium, it's called a synovitis, and that causes fluid production excessively, but it's not very viscous, and that is known as a synovial effusion, and that is what you probably have. And what you will have to do is, the first thing is you'll have to take some rest, and you'll have to ice your knees before and after you play. Before also, when you ice your knees before you play, the way in which blood flows to that area is much better regulated. And also post playing, wrap your knees with ice, wrap your muscles with ice. Trust me, cryotherapy reduces a lot of inflammatory neurotransmitters or cytokines in the area, especially after sport. So please ice before and after, and please stretch before and after. And anybody who's playing a sport, make sure you give 4 days a week in order to strengthen the joints and the muscles which you're using to play a sport. For example, if you're playing cricket, you need to spend 4 days to strengthen your neck and back with your core 1 day, shoulders and glutes 1 day, ankle, neck, knee 1 day, 4th day, core and chest exercises for breathing. You will have to devote time to strengthen these joints so that you don't have any sports injuries. All right. I hope I've answered your question. If I've not answered it, whatever you need to be clarified, just put it down again. I will answer it for you. Ravi Jain, thank you so much. I really hope that it will help your bomb case. This is EJ. Hi, Mr. EJ. I'm 67 years old. Sorry, pop-ups again. I'm 67 years and I have severe pain in the left knee. Should I have to go for a knee replacement surgery now? So, like, I have a set of questions which I ask my patients to decide if they need a knee replacement or not. And I'm going to ask you those 5 questions. So, the first question is, have you woken up from your sleep because of your knee pain in the last 1 year? That is, you slept, but then suddenly you had that much knee pain that you woke up. One. Second, do you climb up and climb down steps one by one, or are you able to climb down steps fast and climb up steps fast? If you're climbing up steps one by one and climbing down one by one, then that's another tick. Then are you comfortable sitting on the floor, or you haven't sat on the floor for the last 1 year? If you haven't sat on the floor for the last 1 year and you're uncomfortable sitting on the floor, that is, you might sit on the floor, but you know that it will be very difficult and very painful, that's another tick. Whether you have pain at rest. See, all of us have pain. Pain is natural. What is not natural is if you have pain even when you rest, when you remove the stimulus. See, movement can cause pain, asking us to rest. When we rest and pain is persisting, then that's another tick. So if you have pain at rest, even when you're sitting, that's another thing. Fifth question. Does your knee get locked often? That is, you're unable to straighten it or bend it, and you're afraid that it will get locked. So if you have 3 of these ticked, okay, then it's a decision. Like, it's your call. If you want to be more efficient in movement and you're above 65, yes, you can go in for a knee replacement. If you have 4 ticks, a knee replacement will really, really help you. If you have 5 ticks, you're already a year late. You should have a knee replacement. And apart from the number of ticks to the questions, you have to take an X-ray, which is known as a standing X-ray, AP view, anterior-posterior view. And that is, you have to have weight bearing. And then when you're standing and you're weight bearing, the X-ray has to be taken. And then there is an angle which we put, known as the varus angle. If your varus angle is above 12 or above 15 and you have more than 3 of the ticks, then you should think about a knee replacement. If you have a varus angle which is very high, that is above 15, and you have 4, a knee replacement would be a fantastic option for you. Then again, you should be ready. If you are ready, then I think the knee replacement is a very good surgery. Hey, thank you, Isaiah, for the appreciation. Okay, Rama Satya says, thanks a lot. It was very useful. I'm very happy that you found it useful. Kishore Kumar says, hi doc, I'm 48 and I get neck pain sometimes and feel tired. Can you suggest some stretching exercise to strengthen my neck? Yes. I have actually made another video which I just released previously, or 2 videos ago, where I've shown exercises specifically for neck pain. I will post the link below on this video so that you can see those exercises. All right, guys. Thank you. Thank you so much for watching. Thank you for the comments. I hope this was useful. I'll see you again very soon with another live video. Thank you, guys. Bye-bye. Thank you so much for watching. Signing off, Dr. Santhosh Jacob.